There we go. Perfect. Yeah, so welcome everyone. Thanks so much for joining us today. I'm Chris Wrightson, one of the co-executive directors of Zero Ceiling. And
I'm Sean Easton, the other co-executive director.
And yeah, firstly, I just wanted to acknowledge that we are here on the shared traditional unceded territory of the Squamish and Little Nations, and we really appreciate being able to live and work here. We're really excited to have this opportunity to report back to the community on the research that Royal Roads University has done over the last couple of months with our community to really help us move forward through the pandemic as we, as businesses and our communities recovering, continuing, whatever words we're using now. As I think many of you know, Royal Roads has a long history with Whistler. Many of us, including myself, have studied at Royal Roads. And for those of you that follow Zero Ceiling, we've been ourselves working with Royal Roads for a number of years as they've helped us continually improve our supportive housing and employment program for youth who've experienced homelessness. And you might be wondering why Zero Ceiling's involved in this project in particular, but employment is a really key ingredient in our program. We place young people in work and support them in those jobs and the businesses to help make those placements successful. And many of the things we're seeing businesses struggling with now are things that we're quite experienced with through that supportive employment program. So things like mental health, individual employee circumstances, communication, all that sort of things. So I'm really happy to introduce Jo Axe to you today. She's a professor in the School of Education and Technology, and Rebecca Wilson-Mah, who's an assistant professor at the School of Tourism and Hospitality Management. A few months back, Jo reached out to me to let me know that her and Rebecca had secured some funding to do this research into the HR needs in a tourism-based community, and she asked whether Whistler would be interested in being the subject of that research. So we said yes, we would be. And Royal Roads really sees their role in the community as, or their role as a university is to be doing projects like this, to be helping communities to really apply their skills, just to help communities better understand what's happening, overcome challenges, and just really apply their research to on the ground to things that are happening. So we really appreciate being the beneficiaries of that. And I also wanted to express our sincere gratitude to the Whistler Chamber of Commerce, who were really instrumental in connecting the researchers to the business community. So thanks so much to Melissa and her team for that. I can see many people on this call who took part in the focus groups, so thank you again for doing that. That's really helping us, all of us, expand our knowledge in this area. So the format is I'm going to hand over now to Jo and Rebecca to present the research findings. Then we'll have a 10-minute question and answer, and then Sean's going to wrap up at the end. So over to you, Jo.
Hi, actually it's over to Rebecca because she's going to start things off for us.
Rebecca, you're just muted. 1 second.
There we go. So I'm unmuted now. Hello, everyone. Hope everyone can hear me okay now and can see the slides. So before we start, Jo and I would like to thank the Whistler Chamber of Commerce and Zero Ceiling for your support for this project. We have certainly appreciated the opportunity to really gain some insight into how COVID-19 has affected the Whistler Resort community and the tremendous resilience and community effort that continues to support employers and employees to navigate each day. We would also like to take a moment to thank the research participants. So many of you are on this call. You gave us 60 minutes of your time in your busy day for the focus group discussions, and our sincere appreciation to you. So we're here today to share our preliminary data analysis with you, recognizing that things are changing very quickly and that we need to get these findings in your hands. So we anticipate the data will contribute to what you are learning from your own experience, from the Whistler Pulse Check, from other data sources, and your conversations with one another. We'd like to acknowledge the traditional lands that Royal Roads University resides on. We acknowledge that we live and work on the traditional lands of the Cosatsan and Lekwungen ancestors and families. And it is certainly with gratitude that we work and learn on these lands. And I thought you might be interested to see this photograph of Snekwa Ellen House, Blue Heron House. This is located at Royal Roads, and it's the home of the Office of Indigenous Education and Student Services. So this is a home away from home for Indigenous students, faculty, and staff. So over to introductions. So thank you, Chris, for introducing Joe and I. We love this dynamic photograph. Joe and I are unfortunately not the mountain biker in red in this photograph. We aspire perhaps to do something as exhilarating as that on top of a mountain. It's just an incredible photo. The main thing you need to know about Joe and I is that we both enjoy qualitative research. We're interested in how people bring meaning to their experiences so we can gain an understanding of the underlying reasons, opinions, and motivations behind the numbers. So I'm going to pass over to Joe now so Joe can introduce herself. So over to you, Joe.
Yeah, hi, thanks, Rebecca. Just to say hi, and there's a lot of people whose faces I recognize in names. Thanks again to you all for showing up to see what happened with the research we did. My name's Jo Axe, as noted, Professor, School of Education and Technology at Royal Roads. I've been around for quite a long time, and I have worked with Zero Ceiling over the last several years, working on some projects with them. So thanks, everybody.
Yes, thank you. And as introduced, I'm Rebecca, and I work in the School of Tourism and Hospitality Management, and very interested in supporting employees and employment, human resource issues, and teaching and learning generally. So here's our agenda. This is the list of items that we'll discuss today. We wanted to share an overview of how we frame this update on our findings for you. We're going to give you a very quick refresher on the research topic and questions, and then Joe will take you through an overview of the literature review. Next, we will discuss the focus group and the data analysis by themes. And we will end with a discussion of the findings and some conclusions. We plan some time for questions. So please make note of your questions as we present out today, and share them with us and with one another at the end. So to the research topic, broadly speaking, we designed a study in consultation with Zero Ceiling that would contribute to other data collected from Whistler employers. So for example, the Pulse survey. So we had a conversation and we developed these questions. Our focus for the study was to understand the human resource needs of Whistler employers in the coming weeks and months with relation to reopening amid the COVID-19 pandemic. We also wanted to explore the hiring and training needs of employees as they return to work and navigate the new normal. It is anticipated that this research will be informative not just for Whistler, but for other tourism-based communities. In our early consultations, we agreed that this study would focus around two primary research questions that are noted on the slide. Given the uncertainties and the swift change that businesses and not-for-profits have experienced since March, we wanted to explore organizational needs as they related to HR and the first phase of opening businesses to develop a fuller picture of what employees need as they engage with hiring and training. I'm now going to pass on the presentation to Joe, and Joe will share lessons learned from communities around the world that have addressed and recovered from major catastrophes. So over to you, Joe.
Thanks, Rebecca. So yeah, I'm going to talk about the literature that we looked into before we started venturing on the data collection that we did with the folks in Whistler. There are 3 slides I'm going to go over the material on, and what I'm going to do is focus on what catastrophes we were looking at. So you can see it's very difficult to find anything like the experiences we're having right now, basically due to the fact that this is an ongoing global challenge for everybody. Some of the things are very localized. You'll see some familiar names in here with the catastrophes we were looking at. And in general term, we went all over the world looking for things that might have some experiences that we could share. Then we looked at recovery strategies. So what were they trying to do as they went through the recovery phase of dealing with the issues that they were faced with? And after that, what did they learn from the things that they've been doing? So we'll go on and start with major catastrophes, and I'll just do a quick outline of the ones that we're looking at here. So you can see that they came from all over the place. We had New Zealand, Colorado, Grenada, and then more locally, Kelowna. We had cruise ships and we had SARS in Hong Kong. And I have to say that probably the 2 that I see more alignment with, SARS in Hong Kong has some similarities to what we're going through, basically because it was a viral-based challenge. And then the more local ones, I think, are also very informative. The fires in Kelowna have some sort of more regional solutions that were applicable. So we'll have a look at the general recovery strategies that they were using and what they were finding. So you can see here that there are 10 different things that we were looking at, the sort of themes that came out of the literature when we were looking at it. And I'll go through each one of these fairly briefly, but if you do have questions, remember to save them for the end, and we'll have some questions at that point. So when we looked at community resilience, we were looking for things like the communication that went out within the community, and how, if it was clear, it encouraged that resilience. If it was confusing and muddied, there was not a lot of helpful information going to help that community be resilient to the issues that were going on around it. The crisis, that feeling of being in a crisis together, that also helps. When people feel that they're working on something and they're not alone, it helps build that resilience. The relationship building, and there are multiple dimensions to relationship building, but again, that helps to build the resilience. We can talk a little bit more about relationships as we're going through the presentation. So the second one was ties to community, which is related to that resilience piece, but you can see that feeling of being bound to the community, and it comes in when you think of responsibilities for staff. So we'll talk about community again towards the end. That's a theme that came out very strongly from the research we were doing, and there are different levels to community and what people were talking about as they mentioned community. But that responsibility for staff was also echoed in some of the data that we gathered from folks in Whistler. Caring about their neighbors, again, that ties to community came through as a recovery strategy. Feelings of loneliness and uncertainty, and trying to support people who had those feelings. So it wasn't just a matter of going out with the people that you knew, but trying to reach out to people who may feel lonely. Excuse me. And that sense of belonging. So residents feel like they belong to something. And in the case of Whistler, this was particularly relevant, I think, is that including seasonal workers and guests in that feeling of belonging. So when somebody comes to Whistler, making them feel like they're part of that community and that they're part of the solution seem to be very relevant specifically to the context that you're living as we speak. That responsibility for staff came through very strongly. So being concerned about staff safety, managing the expectations of staff, and then human resource issues as they come along may be very different from the issues that you're normally faced with. So there may be more things related to family and relationships outside of work that are actually sort of seeping into the workplace. Changes in business operation. This was a fairly a theme that came through in that we want to make sure that the flexibility is around people can speak to feeling that they have to make some changes, that they have to be innovative in order to survive. So that came through as another theme that we were looking at. The flexible recovery planning. So the idea here that we don't know what's going to be happening down the road. We don't know what's going to be thrown at us or how we're going to have to respond to those things. So there's that need to adapt, constantly adapt to the things that are changing all around us that we have no control over. Some things we do, some other things we don't have control over. And remember, for those who are in the focus groups we did, you'll probably hear a lot of these make strong connections to the things that you were talking about. So we can see a lot of similarities between the literature and what was happening in the focus groups. And again, remember, this is just from the literature that we're talking about right now. Combating negative media, that particularly seemed to relate to the tourism Kelowna issues that were happening there and how they responded to the challenges that the media was generating, that people were having, that's fear factor around going to Kelowna, and what types of things that they were doing to combat that particular thing. So the marketing campaigns that they had, the stress on communication being calm, collected and directed to the specific needs of people, that was very important. Hygiene was something that came out of the SARS issues, and also the ships, the challenges around the cruise ships. So the things that the hygiene strategies people were using, the restaurant situations, and we're seeing a lot of that in BC at the moment as we're changing and shifting how we approach going into a restaurant and having nightclubs opened and closed and things like that. And then hand sanitizers was something else. Marketing is a big, I think you could probably do a whole research project on the marketing piece on its own. There was a lot of pieces about that calmness, making sure the information is correct, don't have mixed messages going around, using digital technologies for marketing. And then after the disaster has happened, how you get those domestic tourists back into the communities. International marketing, being aware that there is not the same rules going on internationally if you're coming from a different country, and how you get that international client back again. There were things, again, Tourism Kelowna was doing things like daily media releases, media management issues they had. There were creative marketing, trying to attract local guests back into the workplace. So there were a lot of things to do with the marketing. Like I said, that could probably be a whole research project direction in itself. Staff deployment, there were, and again, some of the echoes that I've heard with things that were happening in Whistler is making sure that if you could employ staff, that they were employed in a way that was healthy to them. The deployment, putting them in different departments, if that was possible, if you have a larger institution. Staff going on leave, taking unpaid leave in some cases. There was cross-training to prepare for when the business was going to turn around and recover. There were allocations to sister companies when there were larger organizations. And some of the duties that were originally signed out to contractors were actually brought in-house and given to staff members to do. And the last one of these is that top-down, bottom-up approach. So this is, I think, in response to the forest fire, and it was talking about the major stakeholders that were in place and how the tourism businesses saw them contributing to during the different stages of disaster. So it was being led almost from the outside in. And with the acknowledgement that moving from small to larger scale is definitely going to change the number and nature of stakeholders that are involved in a corporation or a company and organization. So we're on to lessons learned, and we'll have a quick peek around what they actually learned from the pieces they did. So the good communication piece comes through clearly in much of the conversations we've had, plus the literature. Again, we go back to Tourism Kelowna and how they were reaching out to their existing customers. The visitor information centers in BC were sending out information about fire and safety. So there was lots of information going out everywhere, so people felt more comfortable coming back in. The tourism industry having one voice, establishing protocols for communication, so making sure that consistent messaging was happening, and tourism marketing agencies, the role they had in providing leadership and marketing also came through in the literature. So the collective community, it seems to come throughout the reading and the data that we were collecting in Whistler. The resilience, making sure that you identify as a resilient community, because you embody what you see happening around you. So if you keep saying it, we are a resilient community, we can continue forward, we can make it through these, it has a momentum. People will subscribe to that. That collective response of the community, making sure there's a single message going out, and then wanting to help other people. We heard a lot of stories about people wanting to connect in different ways with their employees and staff, and that sort of thing. Relationship building, the connection there with being prepared for disasters. So if you have strong relationships to start with, oftentimes the actual disaster preparedness clicks into place because you're thinking more in sync. So there's a lot of things that happen prior to a disaster that will actually help sustain you as you're moving through that disaster and your response to it. The need for good communication continually came out, which works in extending beyond the individual, but through organizations and different types of industries. Collaboration with stakeholders, that need for collaborating, planning and recovery, such as for disasters like hurricanes and storms in Grenada. There were fires, that enhanced collaboration between tourism businesses and emergency response organizations. There were needs for extensive collaboration between policymakers, tourism businesses, and then pre-emergency, that need to relationship building, collaboration with all the stakeholders. So you can see that there's multiple dimensions to this collaboration with stakeholders, and it depends on the organization itself on how that would look in reality when you're working in that area. So physical protective factors, I think we're all fairly familiar with that. We're just talking about cleaning, disinfecting, laundry, food, beverages, front desk and hygiene, best practices and that type of thing. So I think we're probably well versed with that in BC at the moment. Disaster and emergency planning. So looking for those vulnerabilities before they happen, acknowledging the future uncertainties, and how do we compensate and plan for that. Build those relationships. Again, that comes strongly forward in this in disaster emergency planning. The one interesting thing was the observation that you use it as a catalyst for changing your business model. And I did hear that as well in the data that we were in our focus groups. So there's that interesting thing is it might not be something you're planning on or wanting, but it's actually, it becomes a catalyst for changing how you're doing things. And it does reduce that ad hoc response. So if you've got a good plan in place, you're more likely to make a strong decision based on an existing plan. The community coordination, again, we've got lots of things going on in the community, making sure people are talking to each other on an individual, on an organizational level, and more broadly. And then document your plan, make sure that you've got something in writing. And the last one on this section is the crisis management planning and implementation. So that, again, that need a community to coordinate a recovery plan and avoid those on-the-fly responses. Crisis management procedures linked to the local community resilience. So again, that we come back to them all the way back to the beginning almost in here with that community resilience piece, and how having a crisis management plan links to how well the community feels that they can deal with and cope and become more resilient. Looking at the long-term impact, so making sure that you're examining all the potential pieces along the way, which it's very difficult to do right now because we don't know what's going to happen next, and how to reopen safely. So revisit those COVID-19 safety plans, make sure that you have one and that it's in place and that it's up to date and it makes sense based on the current situation. And I think that's it. That was a lot of information, but the literature, there was a lot of complexity with the literature, as you can probably tell. So the focus groups will move now into the literature sort of grounds a lot of what we were doing. The focus groups that we did were qualitative, as Rebecca mentioned at the beginning. We have a focus on qualitative research. We like to go deep and talk to people and find out what their experiences are. We had 4 focus groups the week of June 22nd. And they were approximately 90 minutes in length. I think we did go over on a few of them. Just the conversations were really interesting. And then they were what we call open-ended, which means we have a semi-structured format to it, that we ask a question and the question can go in multiple different directions. So there isn't just a yes/no answer. It gets quite deep in the data. And then Rebecca and I had the data coded and themed, with the themes sort of coming out from what you were saying, what was being said around the table. And we used NVivo, which is a software program for analyzing it. So the themes that came out of this, there are 5 distinct themes that came out of the first research question. So we had those 2 questions at the beginning, Rebecca mentioned them. The first one, which was, what are your organizational needs as they relate to human resources in the coming months during the next phase of opening businesses during COVID-19? So from that, we had these 5 themes that emerged from the data, and I'll talk through each one of those, starting with staffing. So I'm going to take the first 2 themes, and Rebecca will jump in on the last 3. So for the staffing theme, you can take a couple of minutes to have I'll stop talking for a minute if you want to just read through those yourselves. Okay, so what we were looking at here, there were a number of different things that came out of this one. So taking time to train new employees, that was challenging. Took time away from the other things you have to do as managers. Challenges in finding and retaining staff, that was a big issue. We had shifts from international to local employees. That was a problematic piece that we're trying to get our head around. The increase incentives, so in some cases there was flexibility in the workplace hours and that type of thing. Looking at employee health issues was something else. The burnout, there's evidence due to stress. Demands of following public health protocols. And then the uncertain business forecasting. So those were the kind of things that came out of the staffing conversations, and the theme that around that. And then the next one is adaptability. So you have 2 secs to read through those. So there were a number of things that came out, and those are 2 representative quotes, but there were things around needing to be innovative, creative, but also seeing it as an opportunity, making sure we stayed open to those changes that were available to us, which reflects back to literature, managing the expectations of staff and customers, so about hygiene, lots of questions around that, how do you do that? And then that adapting to the new normal, the fluidity of having to change our business plans. Keeping individuals and teams engaged, how do you do that? It's different from it has been in the past. Working in an online environment, that's different for some people, so we have to adapt to those new techniques and skills. Safeguarding mental health and physical health, and how do we do that given the current situation? And then recognizing and adapting to different comfort levels from staff and customers. So those were the kind of adaptability pieces that came out of the literature. And I'm going to hand it back over to Rebecca now to discuss the next one, which is uncertainty.
All right, thank you, Jo. So uncertainty was a shared experience that participants identified as elevated and persistent. HR uncertainties included the continuance of employment subsidies, in particular the Canadian Employment Wage Subsidy. There were uncertainty regarding legal questions related to things like sick time, layoffs, insurance coverage, and others. Employee expectations and health needs were identified as uncertain, as COVID-19 affected each employee in different ways. There were also uncertainties related to protocols and safety plans for returning to safe operations. There was agreement that uncertainty was a prevalent undercurrent in HR generally, and with respect to employee support. Moving on to the next theme, communication. This slide has several representative quotes from the focus group participants that illustrate the content of the conversations. Please take a look as I'm talking you through some of my notes here. When discussing issues related to communication, participants noted the importance of presenting a consistent message to employees, customers, and guests. Participants also stated that finding an appropriate balance when deciding how much information to communicate could be challenging. This meant not leaving the recipient with information overload. Participants were pleased when the community communicated their encouragement and support, finding that it kept staff engaged and reduced stress. There were also many proactive ideas shared that related to improving open communication and reducing conflict, such as bi-weekly internal communications and open focus and an open focus on mental health. Also of note were the multitude of necessary stakeholder communication levels, including staff, landlords, as well as federal and provincial bodies. So a lot there in that communication theme. And the fifth theme here is strategies. So strategies for working in the COVID-19 pandemic were varied. Some participants focused on the immediate concerns while attempting to be responsive to emerging needs. There was concern over trying to find a balance between being proactive and being reactive, and challenges such as changing business operations due to developing protocols for health and safety, new equipment, service designs, and room cleaning were discussed. Some participants noted their capacity to adapt by providing opportunities for flexible employment, such as allowing employees to work from home or the necessity of that, and employees coming in on different work schedules were also a significant consideration. There were also strategies discussed, for example, how to monitor guest behavior and how to establish sustainable financial models. So planning ahead, thinking of the future while handling the day-to-day was a big part of the conversation, and the implications for HR were very significant. So turning to our second research question, we had a question in our study, our second one, which was around asking you about hiring and training employees. So asking our focus group participants about what the organizational needs were in relation to HR training and support. For the 4 sectors represented in the focus groups, there were 2 training and support areas that were consistent across sectors. The first was the need for conflict resolution, and the second identified was training and support for difficult conversations. Conflict resolution related to addressing disagreements or misunderstandings with customers or employees or others, and difficult conversations related to interactions in all aspects of the organization. One customer-related example was training related to how to diffuse, communicate, and handle issues with guests who might not follow public health protocols. So just to reiterate, these were the 2 training and HR needs that were identified across all the focus groups, so across sectors, as a consistent need. Next, we're going to share the training and professional development needs of managers and owners, as shared with us by sector in the focus groups. Interestingly, there was a clear need for training and supports for managers, owners, and senior leaders shared across the board in every focus group. While there was a clear focus on problem solving and working day by day in response to COVID-19, there was also an interest in additional training and professional development support. In the food and beverage focus group, discussion focused on help for managers to adjust and manage in this new environment, business restart training and coaching, including how to pivot and long-term forecasting. These were all part of the restart training. And then business training for entrepreneurs. This related to finding new business opportunities and models. In the retail focus group, discussion focused on trust building and adjusting to the new needs of employees. In particular, employees with anxiety and different employee support needs that were emerging. In the accommodation focus group, the discussion focused on how to communicate effectively, including COVID-19 protocols. General professional development for managers and leaders. How to navigate COVID-19 related information. And training related to the employee life cycle. Mental health training was also discussed. How to recognize and approach mental health related issues. Our fourth focus group on this table is a not-for-profit group. This group discussed approaches for seniors and retired employees who volunteer, help to encourage seniors to shift how they engage with the community and do their activities in the community in different ways. So this is all related to adapting to the online environment. Best practices in HR was also something that leaders were looking for. For example, COVID-related change, and best practices in communications, including advocacy for nonprofits in Whistler. So that's a quick summary of the content of that discussion around training and hiring needs. The discussion raised the following list for training and development for staff and volunteers. So taking the focus now to what do your staff and volunteers need. The food and beverage sector discussed tools to explore empathy, communication, problem solving, and self-compassion. There was a discussion about support on how to think about resilience. So how to offer supports to employees in living with uncertainty, economic health, social lifestyle, and so on. All of these uncertainties that are part of COVID-19 and working and living in this new environment we're in. In the retail sector focus group, the participants discussed supporting staff and volunteers, staff, on how to be comfortable with change, and social distancing at work, including self-monitoring. In the accommodation sector, the focus turned to training, so the provincial guidelines and health and safety protocols, so training staff to adapt and to do their work with this change to health and safety protocols and practices. And for the not-for-profit, the focus for volunteers was looking at programs to support mental health, emergency response training, support for volunteers who are adapting to the online environment. And there was some discussion that many volunteers were more mature volunteers who might not be as used to using technology for communications. And then sector-specific education and information. So I recognize that's a lot of information for everyone. Just wanted to cover off all the content of those rich discussions with our participants. And all of this information will also be provided in a report. But at this stage in our presentation, we're just moving to our concluding components. So I'm going to pass over to Joe for our concluding slide regarding a 4C model for supporting COVID recovery.
Thanks, Rebecca. So this is a fairly brief one. Just what we're trying to do here is pull together the essence of what we read about and what we heard, and what seemed to come through in every conversation we had at some point was the importance of communication, coordination, and the ability to connect, and how that drove the community, and that in turn builds that resilience and the ability to recover successfully, and even live in the world we're living in right now, where we don't know when that recovery is actually going to happen, because we're still moving towards it. So the communicate piece in the context of this particular model means that supporting about how we communicate about the workplace recovery. It supports the workplace recovery to communicate with others in multiple different dimensions. There are internal communications and external communication, both of which considered essential. The external communication piece often will revolve around communicating to advocate and educate. the public and funders, so that we can continue to receive funding for various activities that we're doing, and making sure that the public's educated in what we're trying to do as an organization. And then helping people make connections across those sectors. That came out fairly strong in most of the communication, the focus groups we had. It isn't just about our particular organization, but or the sector. It's multiple different dimensions to the communication aspect of it. So the coordinate is the second element of this. So how do we coordinate that partnership with other organizations to build capacity and minimize costs? Because what we find is that multiple different people and organizations doing the same thing is not as efficient as if we can have a collective that then goes forward and builds that capacity to reduce costs to each individual organization. Excuse me. For example, roundtables can help sectors share information and work with each other. So if somebody has found something or knows how to do something, then having that capacity to share it rather than just keeping it to themselves because they don't know what to do with it. The conversations in the focus groups were valuable information sharing opportunities. So that was one comment that came up in one of our focus groups, that even the fact that we were asking these questions in this research, that was actually helpful because they were learning from each other and didn't realize that somebody was already doing this and that they could learn from that. So just opening up those forums and enabling people to see the connections in different ways was very helpful. So then we've got the communication between sectors and organizations, so across from food and beverage to accommodation, because there are many similarities with things that are happening, and the clients, the same clients oftentimes that are coming in, the customers. Take an open approach to explore and share was viewed as a way of to grow those communities and learn. So having a look at what we can do to help each other. How can we share the information we have? What are the channels, what are the forums that we have available to us to do that? So that coordination piece that comes in there. The ability to connect. And again, as you probably concluded as you've been going through this presentation, there's been a lot of discussion about connection and how we can do those efficient connections across organizations. How can we establish those support structures that facilitate the connections between organizations and the wider community? Then the positive impact of having regular meetings that establishes that feeling of connection with others. And this could be internally in a business organization where your team meets once a week just to touch base, or it could be outside that organization, so across the sectors, to actually work and find out what everybody else is doing and how that could positively impact your own organization. Some observations were that meetings and keeping busy helped improve the mental health, but that ability to connect with other people on the team, understand that they're going through similar things, that helps people sort of get through things themselves. Connecting in the virtual environment. So when you can't connect face-to-face, the virtual environment is available, and if it might be a second best, but it's still that ability to connect, and it does have a positive impact on people. So the important for managers to make sure that they keep those connections with the team, have regular meetings, and those types of forums for people to share their things. So all that kind of channels into the community. And there are strong associations with each three of these aspects that build into that community piece. The multifaceted nature of the concept of community. There were some folks who were talking about it as the individuals who make up the organization. So they're in the teams and how those individuals make up that community in the workplace. There were conversations about the different organizations collaborating with each other to learn and share knowledge. So that's across organizations. And then there was the Whistler community itself, and that concept of resiliency and the feeling that if we can build those support structures, residents will feel encouraged and comfortable. So it speaks to that role of the community, which is the collective approach to safety guidelines in Whistler. That came up in a few different conversations. Rebuilding organizations and livelihoods, how do we share in those activities? What training do we have to reestablish values? What values do we have as an organization? and just to have those ongoing conversations. Supporting collective resilience, so how do we as a community support each other and feeling as though they're strong and can survive. And making sure that the mental health of the community was considered when we adopt strategies for the physical safety of its members. So when we're talking about putting masks on, some people feel that, you know, that's not a comfortable thing for them to do. So how do you support those physical safety pieces while also considering mental health issues? Remaining flexible to the demands of that changing physical, social, and emotional environment. And the understanding that while it is all changing, we can adapt and we can do things differently, and we can come up with solutions that are forward facing and that will help us through this. So the community, in summary, it plays a significant role in the survival during the pandemic. And it's also expected to have a place in the recovery from the pandemic. So I think the focus on community is paramount. So that summarizes the report. I think I'm about 2 minutes over time here. So I think the references, if anybody's interested, you'll be able to look at when it's posted. So we can flip through these three fairly quickly. These are some of the literature that we were looking at. And just a huge thank you again to everybody who's been involved in this. Super appreciative of all the people who spent the time in the focus groups with us. That was really, really good. And that's how you can get in touch with us. And so there we are. I think we can open it to questions. Is that correct, Chris?
Yep. So if anyone has questions, you can just type it into the chat, or else put your hand up or unmute and speak. Joe's going to be, Joe and Rebecca are going to be.
Yeah.
I had a question actually, Joe.
Yes.
I was just wondering about whether anything came through in the focus groups or in the literature review you did of particular needs of First Nations employees or businesses.
So we did have, there was some discussion about First Nations, not within the literature review, but within the particular focus groups that we were having. There was a couple of comments came up. It wasn't a really strong focus, but that understanding that there are different needs and the diversity, I think it came through in the diversity conversations that we were having. Rebecca, do you have any?
Yeah, no, I would agree. You know, that recognition that this has affected individuals and families and in the community, but you know that the individual it's just a very individual experience, and really looking to understand each individual person's challenges and concerns, and how they're navigating things and what they need and how they're doing, and a lot of conversation about more check-ins with the team and with employees. How are you doing? And then really listening, like, how are you doing? Let's have a conversation. And so that employee support component was discussed quite a lot.
Yeah, and I think it's a meaningful conversations piece, and listening, being a good listener as well came through.
Yeah.
So I'm not seeing any questions in the chat box.
Yeah, you're welcome to use the chat box. I know it takes a bit of time to kind of think about what question you might like to ask. So you know, it's good to have a little bit of a pause here while, you know, invite you to think and share any questions you might have.
Yeah, and I also, in acknowledgement, that was kind of a power hose of information, a fire hose of information that came at you there. There was a lot of content.
Yeah.
So I'm hoping you can see the connections though with the literature, and I'm going to ask myself a question, because I think this is usually a good one. Was there anything that surprised you? And I think the thing that surprised me the most was that while this is an extremely unique experience that we're all going through and living through at the present time, there were fairly strong connections to other disasters that had happened worldwide, things that we can learn from. And I think when we isolate our experiences and think that they're different, I think we sometimes fail to look to all the potential solutions that have already been developed for similar types of situations, while they may not be so all-encompassing, there are still recovery strategies that can be used. So we have a question. What's the next step with the research? Are there any actions being taken as a result? So we've just got to this point. What we wanted to do was have another round of focus groups directed at seeing where are we now. So how are we changing things? I think Chris and Sean may be able to speak to some of the training pieces that might be coming out of this. I'm not sure. But the idea with this was to provide the tools for people to go forward, to connect with what we've found and see what they're seeing on the, from their own experiences and the skill sets that are available, and hopefully come up with some of the training pieces that we're recommending through the data that we got. Does that seem fair? I don't know, Chris, Sean, did you have anything to add on that?
Yeah, maybe I'll jump in quickly. So all this information, once again, with huge support from the chamber, the results have been fed back to the chamber, and speaking with their team there, they're taking the results and looking how to build it into their programming to kind of distill back into the business community with some tangible actions and some skill development as requested within the focus groups.
Yeah, and I noticed that Diane has mentioned in the chat that on behalf of the chamber, this research is influencing our fall training courses. So that's great to hear that is going forward. It's being used in that way.
Yeah. And then Rebecca, there you go. So we will have also on our website the recording of this presentation, the full report of Joe and Rebecca's, and then the PDF of their PowerPoint as well. So that should be up in the next couple of weeks. We can email everyone afterwards and let them know.
Yeah, we're finalizing, our priority was the presentation pieces, so we're still finalizing the report, but we expect that should be available in a couple of weeks.
Oh, okay.
Yeah, I'm going to spend a couple minutes talking about the supported employment that we do at Zero Ceiling, but I just wanted to invite any last questions before I kind of conclude the presentation. All right.
Yeah, no, over to you, Chris. I mean, Sean, over to you, Sean.
So, as many of you know, and some of you may not, Zero Ceiling has been operating for 23 years. And in that entire time, we've been partnered with Whistler Blackcomb to offer supportive employment to the participants of our program. And what supportive employment means is basically offering an individualized support system to help individuals find success in the workforce that also meet the needs of the employer. So with this, we found as this pandemic was starting to hit our community and really impact local businesses, that the lessons learned in our experience were really applicable to the recovery and the future success of businesses moving forward. And that kind of sentiment came from this research for sure, but also just our conversations with business leaders in town, where in the past, where there was individuals that didn't need individualized support to be successful in work, we saw a growing need for support, compassion, individualized approaches, as Joe and Rebecca just said there, good listening, things that aren't typically built into necessarily a business model. So, and beyond the 23 years of experience that we have as a supportive employer, just in our work at aligning with best practices and making sure we're not necessarily reinventing a wheel that's already out there, we've tapped into a community of learning down in the Lower Mainland. And that group of nonprofits such as us, as well as social ventures and socially driven businesses, have been supported by the BC government to develop a supportive employment toolkit. And that toolkit is called Untapped Talent, a business-to-business guide to innovative hiring and retention. So this just got released in the last few weeks. Some of you may have seen it through our communications. I'm really proud to say that Zero Ceiling sat on the steering committee for this resource. And our intention is to start broadening the organizations that we work with, the businesses that we work with, to help meet their needs. And this, I'll just read a couple excerpts from this guide. So the guidebook, you saw it on the last page of their presentation. It's called Untapped Talent. And this is from the opening paragraph. We know that there are thousands of people in our own community and communities across the province who are ready and willing to work when connected with the right opportunity. Essential to this connection are supportive employers, business owners, managers that are motivated to meet their own employment needs while providing unemployed and underemployed individuals with the stability and dignity that comes with meaningful work. So I think central to the idea of supportive employment is win-win, right? Businesses have shortage of staff, and then there's an untapped pool of talent out there. And what we're trying to do at Zero Ceiling is connect those dots to fill the need of both the organization as well as the individuals in our program. And so Zero Ceiling is going to be offering a workshop to our supportive employment partners moving forward, which we are currently recruiting to expand on this resource. And within the resource, you'll learn business benefits to hiring and retaining untapped talent, recruitment practices to gain access to different sources of talent, and retention practices to keep those employees engaged once they're hired. So and once again, like this whole idea was, this manual was born out of the experience of all these different organizations coming together, but it really came, like the timing of it wasn't coincidental. What we're hearing more and more is there's huge staff shortages, not just in Whistler, which we're all familiar with, but in the Lower Mainland and across the province. So that's motivating employers to think a bit differently. And within the manual, they talk about approximately 1 in 5 Canadians have some kind of disability or barrier, visible or not, to employment. And simply put, this is a huge pool of untapped talent that are ready and willing to work. So progressive employers recognize that workforce inclusion of diverse talent offers significant benefits to their business. Well-documented research from the Deloitte Institute shows that organizations with inclusive cultures compared with those that are not provide many competitive business advantages. 6 times more likely to be innovative and anticipate change, 2 times more likely to meet or exceed financial goals, and on average, they generate 1.5 times the revenue. So there's business benefits to this, as well as you'll be helping make meaningful change in people's lives. So as I said, we're currently looking to expand the work that we do with other businesses. We're really grateful to Whistler-Blackcomb for the experience working with. We look forward to many more years as partners. And if your business feels that they're ready to take a step to become a supportive employer and work with Zero Ceiling, we're really excited to have those conversations, as well as we're working alongside the Chamber to develop some curriculum that can be offered more broadly to the community. And with that, we just want to say thank you once again to the Chamber. We couldn't have done this without them. And we really want to say thank you to Joe and Rebecca and their expertise. They have, once again, helped kind of reinforce the sentiments that all the businesses are feeling in town, and then further that with the research they've done. So thank you.
Yeah.
Yeah, thanks
Maybe everyone can just give them a clap if you unmute.
Oh. Thank you.
Hard to present to a vacuum.
No, it was fun. We appreciate it.
Any final words, Joe and Rebecca? Or?
No, thanks.
Thanks everyone for your time. And as we said, a lot of information. Do contact us if you have any specific questions about the literature or the findings. And the report will certainly support this presentation as well. And thank you so much to Zero Ceiling for your support of this project. And Whistler Chamber of Commerce too, of course. Yeah.
Great. Thanks, everyone. See you soon.
Bye.